In this video, we are going to give an overview of bacteria, bacterial infections, and the prevalence of bacteria in society. We are also going to look at antibacterial surfaces, including the different types that currently exist and how they kill bacteria. Here, we are going to talk about several different topics. First, bacteria and what they are. Second, the diseases that bacteria can cause. Third, the global relevance of bacterial infections. Fourth, the bacteria that are commonly found to cause infections in different countries. Fifth, potential sources of bacteria. Sixth, antibacterial surfaces, including definitions and comparisons with other approaches. And seventh, the different types of surfaces, as well as the mechanisms by which they act to kill bacteria. So first of all, what are bacteria? Bacteria are single-celled organisms, generally a few micrometers in size. Many different species of bacteria are known. Typical shapes include spherical, also known as coccus, and rod-shaped, also known as bacillus. A number of different bacteria are found naturally in the human body and are normally harmless. However, upsetting this balance, either by introducing new pathogenic bacteria to the body or by upsetting the current balance of bacteria in the body by use of antibiotics, can cause people to become infected and contract diseases. There are multiple routes that bacteria can enter the body, which can lead to different types of infections. The symptoms of diseases can vary depending on where the infection is located, as well as the type of bacteria. For example, bacteria can enter and infect wounds. They are also capable of infecting a person's skin. Such infections can lead to the formation of boils, sores, blisters, and crusts on the skin, and can also lead to the affected areas becoming red, swollen, and painful. Some bacteria can infect the urinary tract, which causes symptoms such as pain or burning whilst urinating, and strong urge to urinate frequently. Bacteria can also infect people's respiratory tract, leading to pneumonia, which causes symptoms like coughing, pain, and breathing problems. Additionally, bacteria can enter a person's bloodstream, causing infection of the blood, which causes symptoms like fever and chills, rash, and confusion. Other infections can include the gastrointestinal system, which can lead to symptoms like vomiting and diarrhea, and infections of the central nervous system, such as meningitis, which causes symptoms such as fever, headache, and nausea. This problem of bacterial infections is not simply limited to poor countries or to rich countries, nor to developing countries or to developed countries. It is an issue that affects everyone across the globe. The bacteria known as Mycobacterium tuberculosis, which causes the tuberculosis disease, infected over 10 million people globally in 2016, and 1.7 million people are believed to have died from tuberculosis. One major problem with bacterial infections is the emergence of antibacterial and antibiotic resistance. When bacteria are treated with antibiotic drugs, they can evolve and develop a resistance to the drug or compound used, meaning that it is no longer effective at killing those bacteria. Antibiotic resistance is now becoming a major issue in developing countries, owing to factors such as poor hygiene and the misuse and lack of control over prescription of antibiotics. As we have just discussed, antimicrobial resistance is now becoming a major issue, and so the World Health Organization have released a list of bacteria that are of critical priority in terms of treatment and management of antimicrobial resistance. These include Mycobacterium tuberculosis, which, as previously mentioned, is a major killer globally. It also includes Acinetobacter baumannii, which shows resistance to carbapenems, Pseudomonas aeruginosa, which also shows carbapenem resistance, and Enterobacteriaceae, which show resistance to carbapenems and third-generation cephalosporins. Since the problem of bacteria and bacterial infections is a global problem, we are going to examine the scenario in the UK, Turkey, and India in order to gain a better understanding of how the problem of bacteria affects different countries across the globe in different ways. As previously mentioned, there are many different types of bacteria, and the bacteria that commonly cause infection can vary from country to country. The table shown here lists some of the more common bacteria found in the UK, Turkey, and India, with a tick denoting that the bacteria is a common cause of infection in that country. Some of these bacteria, such as E. coli and Staphylococcus aureus, are relevant in all three of the countries, while others, such as Acinetobacter and Campylobacter, are only relevant in one of the three countries. We are now going to go through each of these bacteria and look at the types of infection they cause, the symptoms of infections, as well as their prevalence in society. E. coli is a bacteria that can be found in the intestines of humans and animals. There are a number of different strains, and while some are harmless, others can cause infections. These can take the form of urinary tract infections, bladder infections, and intestine infections. Infections can be caught a number of different ways: eating food that is infected with the bacteria, coming into contact with the fecal matter of animals, or coming into contact with another person who is infected. Drinking, bathing, or playing in unclean water is also another possible way to become infected. A person with E. coli infection can show symptoms such as diarrhea, vomiting, stomach cramps, and a fever. E. coli is prevalent in the UK, India, and Turkey. The next bacteria is Staphylococcus aureus. These bacteria can cause infection via intravascular surgery and intravascular feeding, as well as catheterization and hemodialysis equipment. Staphylococcus aureus can also cause infections in wounds and burns. Invasive Staphylococcus aureus infections can cause more serious diseases such as pneumonia, mastitis, meningitis, endocarditis, and sepsis. The drug resistance against Staphylococcus aureus is a very big problem, even in developed countries. As mentioned earlier, Mycobacterium tuberculosis is a common bacteria that can be found worldwide. It causes tuberculosis, which is an airborne bacterial infection. The symptoms are mainly a persistent fever, coughing, chest pain, and weakness. Tuberculosis is a well-known disease, and it is one of the top 10 causes of death worldwide. Another well-known bacteria is Salmonella typhi, which causes typhoid fever. It is a waterborne or foodborne bacterial infection whose symptoms include fever, diarrhea, headache, vomiting, and anorexia. This disease is most common in India, and in 2015, 12.5 million new cases were found worldwide. Acinetobacter baumannii is an opportunistic bacteria that causes a variety of different diseases with different symptoms. It can cause pneumonia, meningitis, and bloodstream infections, and urinary tract infections. Multi-drug resistance, including carbapenem group antibiotics, causes serious problems in the treatment of infections of this bacteria. Streptococcus is a genus of bacteria that can cause different infections depending on the species. Streptococcus pneumoniae can cause non-invasive infections such as middle ear infections, sinusitis, and bronchitis. It can cause more serious invasive infections, which can include diseases such as septicemia, pneumonia, and meningitis. On the other hand, Streptococcus pyogenes can cause non-invasive infections like tonsillitis, scarlet fever, and pharyngitis, and invasive infections such as pneumonia, toxic shock syndrome, and necrotizing fasciitis. Enterococcus is naturally found in the gastrointestinal tract of humans and animals, where it is usually harmless. Due to their superior structural properties, they can grow under almost any conditions, including harsh environmental conditions, and can survive in soil, water, and food. The two most common Enterococcus species are Enterococcus faecalis and Enterococcus faecium. These bacteria cause a host of different infections, including urinary tract infections, intra-abdominal infections, pelvic infections, endocarditis, wound and soft tissue infections, meningitis, respiratory tract infections, and neonatal sepsis. Clostridium difficile infects the intestines, causing symptoms such as diarrhea, cramps, vomiting, fever, and loss of appetite. In the UK, treatment can cost up to £10,000 per case, and in 2012, over 1,600 people were reported to have died as a result of C. difficile infection. Mycobacterium leprae causes leprosy, which spreads by prolonged contact with an infected person. It mainly affects the skin. Nodules are formed, and deformities of fingers and/or toes and loss of sensation are observed. According to the World Health Organization, 65% of all new cases of leprosy observed globally are from India. Klebsiella pneumoniae is a common bacterial infection in the diagnosis of pneumonia. It can be found in the human body, such as the skin, throat, digestive tract, and lungs. Klebsiella pneumoniae infections are often hospital-acquired and often occur after a urographic examination. Campylobacter species, such as Campylobacter jejuni, are bacteria that cause food poisoning. It is the most common cause of food poisoning in the UK, with 4 out of 5 cases being caused by contaminated poultry. It is believed that Campylobacter is responsible for more than 280,000 cases of food poisoning each year in the UK, and costs the UK economy an estimated £900 million. Now we move on to the potential sources of bacteria in each of the different countries. Bacterial infections in the UK are much less of a concern than they are in developing countries such as India. This is in part due to the many rules and regulations concerning hygiene, cleanliness, and disinfection, and also due to the much stricter regulation of antibiotics. The source of bacterial infections can vary depending on the bacteria in question. For example, the majority of Campylobacter infections are community-acquired from contaminated, incorrectly prepared poultry. E. coli infections, on the other hand, can be community-acquired via transmission through contact with other infected people or unclean surfaces or water, or they can be acquired in hospital or healthcare settings, for example, via transmission from contaminated staff and patients, or indirect methods such as contaminated catheters, needles, gloves, and surfaces. In India, the bacterial infection scenario is quite different from the UK. It is the most significant public health challenge in India. Such infections are water, air, or foodborne, or can be transmitted by direct contact with infected humans or animals. At present, hospital-acquired infections are also severe in this highly populated country, since they can transmit at rapid speed via surfaces. The main sources of these infections are public sectors like hospitals, schools, slums, and public transports. In Turkey, bacterial diseases are often caused by inadequate hygiene conditions. Bacterial diseases can spread easily in public places such as hospitals, schools, prisons, baths, and public transportation. Turkey have hosted millions of refugees from Middle Eastern countries in recent years. Therefore, the spread of bacteria originating from inadequate hygiene in the camp areas is high. Now we are going to look at the bacteria that can transmit via surfaces. Shown here is a list of bacteria that mainly transmit via different day-to-day use surfaces. Staphylococcus species transmit via hospital surfaces, such as contaminated surgical equipment, ventilators, needles, dressings, cloths, gloves, mobile phones, keyboards, and medical charts. They can also be transmitted in other public areas like classrooms and transports. Next, Pseudomonas aeruginosa spreads via daily monitoring medical devices and support equipment like catheters, portable radiograph equipment, ECG leads, and ultrasound machines. Acinetobacter baumannii transmits through equipment in intensive care units, bed rails, stethoscopes, medical scrubs, gloves, and phones. Klebsiella species spread via gloves, hand-washing sinks, and the floors and walls of classrooms. Corynebacterium species transmit through infected clothes and objects in public areas, on the floors, walls, desks, and chairs in classrooms, and on various outdoor surfaces. E. coli and Clostridium difficile transmit via surfaces in different public sectors like hospitals, schools, and crowded areas. One potential solution to the problem of bacteria transmitting via surfaces is the use of antibacterial surfaces. So, what are antibacterial surfaces? There are three different types. First, surfaces which can prevent the attachment of bacteria and biofilm formation. Second, surfaces that release antibacterial agents. And third, surfaces that kill bacterial cells that come into contact with the surface. Such surfaces are useful to prevent bacterial infections in different public sectors like hospitals, schools, transport, industry, and even homes. Currently, there are other solutions used to cure bacterial infections, such as antibiotics, vaccines, and natural remedies, but all of these approaches have a number of disadvantages. For example, antibiotics can cause common side effects like nausea, allergy, and diarrhea. Overuse can lead to antibiotic resistance, which can lead to life-threatening infections. Similarly, vaccines increase the risk of blood contamination from injections. They can be unpleasant or painful, and they are not always guaranteed to give 100% immunity, with some vaccines requiring regular booster injections. Natural remedies are inappropriate for sudden and severe bacterial infections, and there is a lack of scientific research on herbal medicines. Antibacterial surfaces have several advantages over such conventional approaches. They minimize infections by inhibiting bacterial growth on surfaces in different areas. It is a low-cost, non-invasive strategy to destroy harmful bacteria and could potentially reduce the antibacterial resistance problem, which is a growing threat worldwide. Antibacterial surfaces can be categorized mainly into three groups. First, bacteria-repelling surfaces that show superhydrophobicity. Second are surfaces treated with leachable antibacterial agents. And third are surfaces that kill bacteria which come into direct contact with it. We are now going to describe each of these antibacterial surfaces and explain how they are antibacterial. A water-repelling surface can prohibit bacterial growth, giving it its antibacterial properties. When the hydrophilic bacteria cells try to attach to such a surface, the surface will prevent their attachment and subsequent biofilm formation, which is achieved by repelling the bacterial cells. Next is the leachable antibacterial surfaces. Such surfaces are typically fabricated by incorporating metallic nanoparticles such as silver, copper, and gold, which are released from the surface upon bacterial contact and kill the bacteria cells. This schematic indicates the mode of action of nanoparticles like silver or copper on bacteria. First, adhesion of silver nanoparticles takes place onto the surface of the bacteria cell wall. Then, the silver nanoparticles penetrate inside the cell and release silver ions, which damage intracellular structures such as ribosomes and biomolecules like proteins, lipids, and DNA. Next, they induce cellular toxicity by generating reactive oxygen species and free radicals. Finally, these actions promote bacteria cell death. Contact kill surfaces can be split into two different approaches for killing bacteria cells. The first approach is by chemical means, where surfaces contain metal oxide nanoparticles or quaternary ammonium compounds. And the second is through physical interaction, where the surface possesses distinct nanostructures like nanocones, nanofibers, nanopillars, or nanospikes. This illustration represents the contact-kill antibacterial mechanism of metal oxide nanoparticles like titanium dioxide or zinc oxide embedded in a surface. Typically, these nanoparticles absorb UV radiation and consequently generate energized negatively charged electrons and positively charged holes. These energized species catalyze the water hydrolysis reaction, inducing the formation of hydroxyl radicals as well as reactive oxygen species. Such extremely active oxidizing species then act to decompose the bacteria. The hydroxyl radicals formed through this process also cause damage to DNA of the living microbes, promoting cell death. Surfaces fabricated with quaternary ammonium compounds also exhibit contact-kill antibacterial effects. When the bacteria cells come into contact with these compounds, the electrostatic interactions between the positively charged quaternary ammonium compound head group and the negatively charged bacterial cellular membrane lead to leakage of cytoplasmic material from the cells, which ultimately kills the bacteria. This schematic describes the method of bacteria killing on a non-leaching nanotextured surface through physical interactions. In this case, after bacteria cells come into contact with a nanotextured surface, strong shear forces are imposed on the bacteria's membrane upon attempts to move away. The severe shear stress then initiates damage in the membrane, which ultimately causes leakage of cytoplasmic material from the cells, thus killing them. In summary, we have discussed how bacterial infection is a common healthcare problem worldwide, and sometimes acute, such as in the cases of developing countries like India. Uncontrolled use of large numbers of antibiotics is fueling the evolution of resistant microbes. Therefore, use of only antibiotics is not a definite solution to control such bacterial infections. Infections transmit via different day-to-day use surfaces which come into direct contact with humans. This includes things such as medical devices, dressings, surgical instruments, clothing, mobile phones, and computers. Hence, fabrication of antibacterial surfaces is desirable, since they are capable of destroying harmful bacteria before they reach people, and also reduce the risk of antibacterial resistance.